everybody, what's up and welcome to the 88 Dental Marketing Show. This is the internet's only dental show that's answering marketing's most important questions. Believe that, that's what we do. I am your host, Joshua Scott, and this is episode number 21. It's hard to believe that for 21 episodes we've been answering such important marketing, world-changing, life-altering questions for 21 episodes. But we're here, we're doing it, we're rolling. As you can tell from the start, I should probably apologize for the obnoxious tan. I've been on vacation, and I know you're jealous. We had a good time relaxing. It was good to step away, take a little bit of a break. But man, I'm looking forward to getting back, answering some questions. We got some good ones today. But before we do, a few things. This month's articles are still up. You can find them over at medium.com, but I will leave them down in the show notes, some links to them below as well. Does LeBron James drive a Kia? That's one of the articles that are up, talking about athlete endorsements. Do they really work? Why not? Some examples in there. DIY marketing, that's another one. When to handle your own marketing and when to hire somebody to help. That article is up. And then last, why are gas station restrooms so bad? That article is up as well, just talking about some maybe overlooked marketing opportunities in dental practices that we may have missed, or an opportunity we may have missed. So interesting article, would love to get your thoughts on any of that. And then also, this show's episode is sponsored by the good people over at DDS Match. DDS Match is led by Thad Miller. He's a colleague of mine, friend of mine. I've known Thad for a long time. Great guy. DDS Match is about connecting buyers and sellers together for a successful transition. They do a great job at it. Thad is truly an expert in that field and in that industry. And so he's worth calling if that's you. If you're facing a transition, you're looking to buy, you're looking to sell, get in touch with Thad. Even if you're not in his state and he can't represent you, he may be able to connect you with one of his affiliates or just a referral of his that he knows who will take care of you. So give these guys a call. Connect with them, ddsmatch.com. And again, you know my rules for being on the show is, number one, they got to be awesome. I mean, Thad is an awesome guy. So if I'm going to tell you to call somebody and you call them, I'm expecting you to be taken care of. So Thad will take care of you. He's an expert. He's going to answer your questions. And number two, if you do business with Thad or with DDS Match, I get $0 from it. So just so we're clear, it's awesome people. Awesome people make the world go round. We need more awesome people in our lives. That's what that is. Connect with him, call him. He'll take good care of you. And yeah, man, I am ready. Let's get to some questions.
Question number one comes from Dr. Joe Wigfield. What is the most effective form or style of marketing for dental practices?
Dr. Joe, good question. By far, the most effective marketing program is internal referrals, internal marketing. It's the cheapest, most cost-effective, easiest, and usually brings in the highest trust level of patients. If they're coming from a friend or family member, it usually costs you very little, and they have high trust coming into the practice. And so I like to have a 3-step referral process in place in our practices, and it's ask, incentivize, and invite. So number one, just ask the patient. Number two, incentivize them for bringing those referrals into the practice. And then number three, give them an invite to help them ask their friends and family. So I like to use a kind of traditional looking gift card. This is for $50 off the new patient exam. And you can tell on the back it's got a barcode. I mean, it looks like a nice gift card. This is like plastic that you would get at a nice restaurant or something. And so you give this to your existing patients and say, hey, we love seeing you so much. We'd love to see your family and friends as well. Here's a $50 gift card. Please give this to them the next time you see them. have them make an appointment, tell them you sent us, and we'll take amazing care of them. So ask the patient, incentivize them, and then give them an invitation to be able to hand out. Now, the way this works, and here's another one. This one's actually $110 off, and it has a nice little holder to it, which I like. So again, you're just trying to make it look professional. You're trying to make it look like every other gift card out there. I mean, barcode on the back doesn't have to work, but like just put a barcode on there and make it look like it does something important. So, but yeah, and then when the referred new patient comes in, then give your existing patient, match that. Give them the $50 off future credit, or $50 credit off towards future treatment as well. So call it like a 50-50 program or whatever. $50 off to the new patient who comes in, $50 off for the existing patient. But the point is, make it look nice, make it look professional, put an invite in their hand, incentivize, and then just ask your patients.
Our second question comes from Kyle Schmidt. Internal or external marketing? Which is more important?
Kyle, again, internal marketing, the most important by far. Like we talked about, the easiest, most cost-effective, and usually brings patients with the highest level of trust. So it's the most important. However, and here's the big however, most practices tend to top out at about 25 new patients per practice, per doctor. So that's kind of what it's what I call the metabolic new patient rate. Most practices, on average, one doctor will just metabolically naturally see about 25 new patients. So if that works for you, great. If you need more than 25 new patients, now you've got to do external marketing.
The third question is from Dr. Bob Osbourne. How is the evolution of the dental industry affecting the business model in terms of relationships to the public?
Dr. Osbourne, good question. In fact, I mean, great question. It's a mouthful for sure, but you know, healthcare is becoming more and more relational. And so that's where the business model is going, and it's going to have to go. And so the biggest challenges out there for healthcare, and I'm putting dentistry in that for sure, is learning how to speak people. Learning how to speak people, not speaking the language of healthcare, but speaking human, speaking compassion, speaking empathy, speaking simplicity. That's what healthcare has to do, and that's where the business model has to evolve with. Is I am choosing healthcare professionals based on their ability to know me and to slow down enough to get to know me. I am very much not interested in a quick process and this machine of pushing patients through and just diagnosing and treating and they're out. That's not my version of a trusted advisor, trusted professional. And so that's what I'm looking for. It's interesting because, well, it's been a decade or more, but there was a really great JAMA article, the Journal of the American Medical Association, JAMA, that came out, and most of us know this. I mean, most healthcare clinicians know this article, but it talked about the link with malpractice suits, that doctors got sued for malpractice. Those lawsuits weren't based on clinical competence, they were based on a lack of communication. So the doctors that got sued more, there was no difference in clinical competence. That wasn't the deciding factor. It was literally the doctors who spent less time with those patients got sued more. And when we think about that, it makes sense, right? I mean, when we feel like we've been misdiagnosed or we've had a problem with treatment, it's been because the physician or the healthcare specialist didn't listen to us. They didn't take the time to communicate. And so I think that is going to be one of the defining factors, the shifting of the model. I think we're already seeing it majorly in healthcare. I think we're going to have to follow suit with that in dentistry. And honestly, I think it's a really, really good thing. So your homework for this episode Number one, how much time do you spend on average with patients? And is that interaction scripted? Is it choreographed? Do you have a set of questions that you ask or you talked with a patient about? So just interested, maybe think through that. Think through choreographing it a little bit just to make sure that we're spending the time with the patients, getting to know them, and developing our relationship as a trusted healthcare clinician provider for them. Guys, appreciate you hanging around for episode number 21. It's been a pleasure. I hope you're getting some value out of it. Let me know, leave some comments. I will see you next episode.